in particular areas, and it is now over quite a large part of the country on the left. And on the right, you can see the rate of change. Anything in brown or yellow, the rate is increasing. The darker the colour, the more rapid the rate of increase. And again, across virtually the entire country now, there is a significant rate of increase. Next slide, please. The thing which correlates most with future NHS capacity and NHS activity from COVID is the spread in people over the age of 60. Although people younger than that can certainly get severe COVID, and some of them may need hospitalisation and indeed intensive care, the majority of the disease that causes really severe disease is in that age group. And as you can see, that's a smaller area, but again, that has widened very considerably and is going up across the country. Next slide, please. Data from the ONS, the Office for National Statistics, which is the official data, which is done as a survey across the country, shows that the prevalence of this disease has been going up extremely rapidly over the last few weeks, having been very flat due to the work of everybody in the country over spring and summer. And we now have around 50,000 new cases a day, and that is rising. Next slide, please. If we look around the country, thanks to the work that everyone is still doing, the R is substantially lower than it would have been if people were not doing the social distancing, were not doing all the things in families, in firms, around the country. It would be going up much more rapidly than it is at the moment. But there is an increase in virtually every part of the country, apart possibly from the northeast, where they have been taking additional measures, substantial additional measures, and there is some evidence of some flattening, but not yet of any evidence of the coronavirus falling. And that is important because it is now at quite a high level, and if things went wrong, the margin of error is very, very small. We have very little headroom, even in the one area where there is some flattening at the moment. So things are going up across the whole country. Next slide, please. And it's probably important to think about this in terms of ages. These heat maps go from left to right over time, so the right is the most recent, and from bottom, which is children under the age of 16, up to top, which is people over 60. And as you can see, what happens in every area is that it gets darker, meaning there's more cases all the way through the period we're looking at, and it steadily moves up the ages. So it doesn't remain constrained just to one age group. And the top line is beginning to darken in every part of the country, and those are the people over 60 who, as I say, will translate over time into some cases in going to the NHS. Next slide, please. And we're now beginning to see this is moving over to NHS activity, we're beginning to see this with a rise in the number of hospital admissions in England by age group, and this is just looking at people at different age groups. There is a rise in virtually every age group in older adults, basically anyone over the age of 45. The rise in number of people going into hospital with COVID over time. And this is obviously going up not in a straight line, but in an accelerating line. Next slide, please. If we compare the number of people in hospital at this moment with the first peak of COVID, these are NHS people in NHS beds in England by NHS region. Currently, only in the northwest is this coming close to the peak that we previously had, but it is increasing in every area. And if we do nothing, the inevitable result is that these numbers will go up and they will eventually exceed the peak that we saw in spring of this year. Next slide, please. And therefore, if you look at the NHS as a whole, inpatient beds, dark blue is August, light blue is September, and purple is October. You can see it was still falling in August. In September, initially flat, and then a very gradual increase in numbers, but now it is going up steadily on an exponential curve. Next slide, please. Looking at individual hospitals, NHS hospitals, these are the hospitals with more than 100 COVID inpatients in them. This number will increase over the next weeks. And in green are hospitals which have got below half of their previous peak. In orange is the point where they actually get to half the number of people in hospital they had at the COVID peak. And in red is where they exceed the number of hospital inpatients they had at the peak of the first wave of this. And as you can see, the progression is steady, and we now have several hospitals with more inpatients with COVID than we had during the peak in spring. Next slide, please. Fortunately, the death rate, although rising, is still significantly below the peak, but the mortalities rate, the death rate, will track the number of people going into the NHS over time with a significant delay. And we're seeing increases now that are quite noticeable in the northwest, Yorkshire and Humber, and the northeast, and increasingly in the Midlands as well. But the other areas will follow because they will follow the NHS admissions. So that's all the data in terms of looking backwards. Those have already happened. Patrick is now going to talk briefly about the projections forwards.
Thank you. Can I have the first slide, please? So just to recap, at the moment, these are three different ways of looking at it from different studies or the consensus group from the modelers of the number of people every day with COVID, catching COVID new, and it's 50,000 plus most likely as the number, and perhaps 500,000 people or more overall with the disease. Next slide, please. The R was relatively flat and below 1. Below the red line means the epidemic is shrinking, above the red line means it's growing. And you can see from August onwards, the R went above 1, the epidemic grew and continues to grow. So although some of the measures that are in place have eased off perhaps the rate of growth, it's still growing. And that growth from a high baseline means numbers get very big quite quickly. Because of this continued R above 1, the modelling group asked a number of academic groups to create scenarios as to what might happen on assumptions that R stays above 1 and goes between 1.3, 1.5 and possibly up over the course of the winter. And the next slide shows the early working from 2 weeks ago of some of those groups looking at deaths in England over the winter period. So this is early work scenarios looking at this on the assumptions of R, different groups, and as you can see, different groups come up with different answers depending on their models. But what is clear from all of them, in terms of deaths over the winter, there's the potential for this to be twice as bad or more in terms of the first wave compared to the first wave. So the models are clearly showing that this could be the case in these scenarios that are presented here. I want to move though from scenarios to now looking at the 6-week projections, which are more based on data now and have greater certainty than you can ever get when you're looking months ahead. This shows the hospital daily admissions. You can see the first peak on the left-hand side, and then over to the right-hand side, you come up to date, today, and then the projections forward over the next 6 weeks. And this is a consensus view across a number of modelling groups. And what you can see here is a projection that over the next 6 weeks into early December, the numbers exceed the numbers of hospitalisations in the first wave peak. And as Chris has already said, in some hospitals you see that already, but this suggests across the country as a whole we would see this. Some hospitals earlier than others, some a bit later, but this is the projection in terms of hospital admissions over the next 6 weeks, with the uncertainties in the shaded blue area. Next slide, please. Inevitably, hospitalisations lead, unfortunately, to deaths in some people. Again, you can see the first wave on the left-hand side, and the dotted line indicates the top of the first wave. And on the right-hand side, you can see the projection from today going forward in the blue. And again, the light blue indicates the uncertainty range. But what you can see is the model suggests increasing, the models, this is a consensus across models, suggest increasing deaths over the next 6 weeks, so that by the beginning of December, the 8th of December, this is very close to the first wave peak, if nothing is done. Now, clearly, if you stop the R from increasing, if you allow the R to come down, then you would flatten this off and then potentially reverse it. But on the current trajectory, that is what is thought to be the prediction for deaths over the next 6 weeks. And of course, that would continue to go up because the hospitalizations already exceeded the first wave peak. By this time, deaths would follow. So unfortunately, it's a very grim picture in terms of what this looks like in the absence of action and continued growth. Next slide, please. This is a complicated slide. It's from the NHS and it shows what the impact of this would be on NHS beds. So on the left-hand side is acute hospital beds, and on the right-hand side is ventilator beds. It's the same curve you've just seen. So the first peak on the left and then the projection on the right. So the projections that I've just shown you lead, when the NHS do their bed calculations, as peak usage being exceeded on the 20th of November. That's obviously not a precise estimate, but where this would fall on average, that the extra available beds would then be exceeded a couple of days later, 3 days later, and then extra capacity caused by having to postpone, unfortunately, all the things that nobody wants to postpone gets exceeded sometime later in December. And a similar picture is seen on ventilator beds, where the peak gets reached at the towards the end of November or in December, and the currently available get breached a little bit earlier. So this is a picture of what the NHS pressures would look like under the scenarios that are in the 6-week projection. I'll hand back to you, Prime Minister.
Thank you very much, Patrick, and thanks, Chris. Look, I'm afraid no responsible Prime Minister can ignore the message of those figures. And when I told you 2 weeks ago that we were pursuing a local and a regional approach to tackling this virus, I believed then, and I still believe passionately, that was the right thing to do. Because we know the cost of these restrictions, the damage they do, the impact on jobs and on livelihoods and on people's mental health. And no one wants to be imposing these kinds of measures anywhere. And we didn't want to be shutting businesses, pubs, restaurants in one part of the country where incidence was very low, when the vast bulk of the infections were taking place elsewhere. And our hope was that by strong local action, strong local leadership, we could get the rates of infection down where the disease was surging and address the problem thereby across the whole country. I want to thank the millions of people who've been putting up with these restrictions in their areas for so long. I want to thank local leaders who've stepped up and local communities, because as you can see from some of those charts, you know, that the R has been kept lower than it would otherwise have been. And there are signs that your work has been paying off, and we will continue as far as we possibly can to adopt a pragmatic and a local approach in the months ahead. But as we've also seen from those charts, we've got to be humble in the face of nature. And in this country, alas, as across much of Europe, the virus is spreading even faster than the reasonable worst case scenario of our scientific advisors, whose models, as you've just seen, now suggest that unless we act, we could see death in this country running at several thousand a day, a peak of mortality, alas, bigger than the one we saw in April. And as you've just seen, even in the southwest, where incidence was so low, and still is so low, it's now clear, though, that the current projections mean that hospitals in the southwest will run out of capacity in just a matter of weeks unless we act. And let me explain why the overrunning of the NHS would be a medical and a moral disaster beyond the raw loss of life. Because the huge exponential growth in the number of patients, by no means all of them elderly, by the way, would mean that doctors and nurses would be forced to choose which patients to treat, who would get oxygen and who wouldn't, who would live and who would die. And doctors and nurses would be forced to choose between saving COVID patients and non-COVID patients. And the sheer weight of COVID demand would mean depriving tens of thousands, if not hundreds of thousands, if not millions of non-COVID patients of the care they need. And it's crucial to grasp this, that the general threat to public health comes not from focusing too much on COVID, but from not focusing enough, from failing to get it under control. And if we let the lines on those graphs grow in the way that they could, and the way that they're projected to grow, then the risk is that for the first time in our lives, the NHS will not be there for us and for our families. And even if I could now double capacity overnight, and obviously I'm proud that we have massively increased capacity. We do have the Nightingales. We've got 13,000 more nurses now than we had last year. We've got many more doctors. But it still would not be enough, because the virus is doubling faster than we can conceivably add capacity. And so now is the time to take action, because there is no alternative. And from Thursday until the start of December, you must stay at home. You may only leave home for specific reasons, including for education, for work, let's say if you cannot work from home, for exercise and recreation outdoors with your household or on your own with one person from another household, for medical reasons, appointments, and to escape injury or harm, to shop for food and essentials, and to provide care for vulnerable people or as a volunteer. I'm afraid non-essential shops, leisure and entertainment venues will all be closed, though click and collect services can continue and essential shops will remain open, so there's no need to stock up. Pubs, bars, restaurants must close except for takeaway and delivery services. Workplaces should stay open where people can't work from home, for example, in the construction and manufacturing sectors. Single adult households can still form exclusive support bubbles with one other household, and children will still be able to move between homes if their parents are separated. If you're clinically vulnerable or over the age of 60, you should be especially careful to follow the rules and minimise your contacts with others. I know how tough shielding was, and we will not ask people to shield again in the same way, but we are asking those who are clinically extremely vulnerable to minimise their contact with others and not to go to work if they're unable to work from home. I'm under no illusions about how difficult this will be for businesses which have already had to endure such hardship this year, and I'm truly, truly sorry for that. And that's why we are going to extend the furlough system through November. The furlough scheme was a success in the spring. It supported people and businesses in a critical time. We will not end it. We will extend furlough until December. There will be some differences compared to March, and these measures above all will be time limited. Starting Thursday the 5th of November, they'll end on Wednesday the 2nd of December, when we'll seek to ease restrictions, going back into the tiered system on a local and a regional basis according to the latest data and trends. Christmas is going to be different this year, perhaps very different, but it's my sincere hope and belief that by taking tough action now, we can allow families across the country to be together. My priority, our priority remains keeping people in education, so childcare, early years settings, schools, colleges and universities will all remain open. Our senior clinicians still advise that school is the best place for children to be. We cannot let this virus damage our children's futures even more than it has already, and I urge parents to continue taking their children to school, and I'm extremely grateful to teachers across the country for their dedication in enabling schools to remain open. And it's vital that we keep provision for non-healthcare groups going. So please, and this is really important, unless your clinicians tell you otherwise, you should continue to use the NHS, get your scans, turn up for your appointments and pick up your treatments. If at all possible, we want you to continue to access these services now and through the winter. Indeed, it's only by taking this action that we can protect the NHS for you. On Monday, I'm going to set out our plans to Parliament. On Wednesday, Parliament will debate and vote on these measures, which, if passed, will, as I say, come into force on Thursday. We've updated the devolved administrations on the action we're taking in England and stand ready to work with them on plans for Christmas and beyond. We should remember that we're not alone in what we're going through. Our friends in Belgium, France, Germany have taken very similar action. And so, as we come together now to fight this second wave, I want to say something about the way ahead, because people will reasonably ask, when will this all end? And as I've said before, I am optimistic that this will feel very different and better by the spring. It's not just that we have ever better medicines and therapies and the realistic hope of a vaccine in the first quarter of next year. We now have the immediate prospect of using many millions of cheap, reliable, and above all, rapid turnaround tests. Tests that you can use yourself to tell you whether or not you're infectious and get the result within 10 to 15 minutes. And we know from trials across the country in schools and hospitals that we can use these tests not just to locate infectious people, but to drive down the disease. And so over the next few days, weeks, we plan a steady but massive expansion in the deployment of these quick turnaround tests, applying them in an ever-growing number of situations, from helping women to have their partners with them in labour wards when they're giving birth, to testing whole towns and even whole cities. The army has been brought in to work on the logistics, and the programme will begin in a matter of days. Working with local communities, local government, public health directors, organisations of all kinds, to help people discover whether or not they're infectious, and then immediately to get them, to help them to self-isolate and stop the spread of the disease. And I can tell you tonight that the scientists may be pretty uniformly gloomy about the immediate options that we face, but they are unanimously optimistic about the medium and the long-term future. We will get through this, but we must act now to contain this autumn surge. We're not going back to the full-scale lockdown of March and April. The measures that I've outlined are less prohibitive and less restrictive, but I'm afraid from Thursday, the basic message is the same. Stay at home, protect the NHS, and save lives.